Other things that we can help you out with potentially are looking at breeding indices, how you feed your cattle, and the classic one that everyone thinks of when they think of the vet, disease control. This is defected Willy. Essentially something that thankfully we picked up. But this is Alex Walter's work. He pulled together all the bull fertility tests that we've done in the practice right across the country. And essentially you can see that for those younger bulls, around 70% of them pass, and there may be an age-related issue going on thereafter. These are things that we would hope that we could do with all of you guys for beef, essentially this looking at beef, percentage of the herd pregnant by week of breeding, whether that's something that you monitor and accuse some or not. And essentially then also having a look at where you're going genetically. The guys that are on Signet will be getting these things regularly. But essentially, really important things to look at. It only takes one wrong bull and can set you back a long way. So we do get involved in that. Those Charlie breeders may recognize some of the bulls here, but essentially we do get involved in helping essentially determine where we're going genetically with herds. We can also look at inefficiencies of growth, and this comes down to the fact that what I was trying to get, how many of you guys actually look at your average daily live weight gain and monitor it so that you can actually make a difference when it's going wrong. This is just an example. You could pull it out into whether you're finishing something or whatever. But essentially, if we set our target at 0.8 kilograms per day to breed a replacement animal at 13 months, and we wanted to achieve a breeding weight of 395 kilos, if we had a variation in average daily live weight gain of just 0.09 kilograms per day, the outcome we'd get is we'd reach our breeding weights between 13 and 16 months, and we may have a conception rate of 50% and a calving spread then of 22 to 29 months of age. If we can minimize that to an average daily live weight gain variance of 0.05 kilograms per day, seems like a very small amount, and we can increase our conception rate by 10%, our average age to first calving could be around 24 months. How do we do that? We assess housing, nutrition, and essentially disease control. And not necessarily the diseases that you see animal flat out, or you see an animal coughing its guts up or whatnot. Essentially, it could be those subclinical infections that are silently robbing you of profit. We've had quite a lot of discussion today about connecting with our consumers. And whether we like it or not, we do have to consider how we're using antibiotics within the food chain. Now, it could be argued that antimicrobial resistance isn't a high-profile issue for beef cattle or sheep. But can we afford to stick our head in the sand, or in this case, in a tree? Lack of conclusive evidence showing strong links between antimicrobial usage and antimicrobial resistance in beef and sheep. There isn't the evidence there, really. But the feedlot sector is likely to account for the highest and largest amount of antimicrobial usage. And if we consider where we're set now with wormers, it does make you think about whether the industry is being responsible with its use of medicines, and I count the veterinary industry in that as well. It's important that we realize that those antimicrobials are strategically used as part of a commercial system. They reduce morbidity and mortality, they can improve animal welfare and well-being, and can be supportive of food safety initiatives. So education of our public is important, as was alluded to earlier. But here's the challenge. Do you, each time you use an antimicrobial, an antibiotic, document that it was used? Do you, every time, ensure that you've got your withdrawal periods written down so that we can actually trace that through? Do you ensure that your vaccine is kept appropriately, making sure that the fridge does work, that the fridge door was always locked and not lying open? And how do you ensure that if you're employing people that they're actually using the right amounts of antibiotic or anti-inflammatory or vaccine that they should be, and how they're using it? But it's a lot more than that when we're talking about responsible use of medicines. We do need to start looking at focus on clinical outcomes. We do need to start looking at whether we can assess antimicrobial resistance on individual units. And we need to work out what we don't know. It's important then that we conduct targeted research to address those knowledge gaps and that we reevaluate those over time. But it's also important that we keep that communication with our stakeholders and with our end consumer. Many of you will have been expecting me to stand here just to talk about diseases. I can name many. As an island nation, somehow now we're dealing with foot and mouth disease. Blue tongue we've dealt with, and Schmallenberg. Has everyone here experienced Schmallenberg or not? Do you know if your herd has experienced Schmallenberg? Have you done any surveillance work to determine whether Schmallenberg has moved through your flock or through your herd? There's a challenge perhaps that's set. But all these challenges are going to come up, and we are going to have more of these foreign infectious diseases. These are vector-borne diseases. They're in flies, mosquitoes. They have no respect for boundaries. But yet, whenever we were investigating Schmallenberg, for instance, the AHVLA was offering free testing for Schmallenberg. Everyone wanted to know in our area. Bearing in mind I'm in the southeast, I'm one of the vanguards for new infectious diseases coming into the UK from Europe. Everyone was wanting to know, have I had Schmallenberg? Not that we could do anything about it. We didn't always find Schmallenberg, and in fact, in most cases, we find toxo, we find enzo, things that we could actually do something about. Why worry about the fact whether you had Schmallenberg or not, whenever you had toxo and enzo on your farm that you could actually do something about, and potentially has zoonotic implications for farm workers? The other things that we're dealing with and enduring: sheep scab, foot rot, liver fluke. 30% of cattle livers were condemned for liver fluke this year. It reduces feed intake by 15%. We can make a massive difference. And wormer resistance. For those of you that have sheep flocks, do you know what your wormer resistance profile is? You probably suspect you've got your white drench resistance, but what about all the others? And is it just a saving grace that we've had 2 more wormer groups come in just at the right time? If we consider cattle, we talk about TB, and I'm not going to be drawn into the argument about how we're controlling TB in the UK. Yet it seems that we're not getting on top of that situation. Yet there are other diseases that scourge the beef and dairy industries, such as BVD, very easily to get on top of. And in fact, Scotland's getting on top of it. Ireland's getting on top of it. What are we doing in England and Wales? Are we going to get left behind? Yonis, a number of breed societies advise that you should be part of a Yonis accreditation program. Those of you that aren't addressing Yonis and haven't addressed Yonis that are sitting here in this room, bearing in mind how young we all are, if you're not addressing that, think about your children that might be taking on your farm. If you don't get on top of Yonis now, you're impacting what they're going to be farming later on. And then there's those hidden diseases, coccidiosis, a bit of rotavirus, a bit of coronavirus, all of which can be controlled. And if you don't know you've got these things, you can test for it. But how often do you test for those things? Are you happy with the risk that you might have a bit there that might become a problem? Or would you be happier trying to prevent it and getting on top of that problem? So how do we see ourselves working as a veterinary practice? Well, many of you may just see us as the veterinary resource at the top of this diagram. Essentially where we have our consultants, we're the vets, we'll go out on farm, we'll have a few software tools that we run around with and give you some nice reports. But I'd like to think that we as a business, and certainly the modern livestock vet, can provide you with much more than that. Yes, there'll be the production and consulting services, they should definitely be helping you and assisting you in monitoring and modelling disease and production traits, so morbidity and mortality, average daily live weight gain and carcass attributes. But more so, they should be providing a gateway for new research and development and technologies to be getting down to your farm at your farm level. But fundamental to most of these things working is doing the monitoring and the analysis and having the database to work from. In the previous talk, you heard about how we could predict for TB in genomics. Essentially, that went through about 5 different databases to be able to pull all that together. Where do you pull all your data together that you can analyze and monitor? And essentially, if you can't monitor it, you can't measure it. And we know that if you do performance recording, you will definitely improve your production. But if you report that back and analyze it, you'll accelerate your production. How have we tried to integrate with you guys as beef and sheep producers? Well, we've turned things on its head a little bit, and so you can now join up with production improvement plans within our practice, which is essentially a structured approach to health planning. It picks out which areas you want as part of your veterinary service, and essentially you have 2 vets that you work with to do that. And essentially we're changing that variable cost to more of a fixed cost, where essentially you pay a certain amount every month for a certain amount of a level of service. And that fundamentally moves around pregnancy diagnosis in beef cattle, herd health planning, and bull fertility testing. And thereafter you can add on whatever else that you wish to add on, whether that's trace elements or whatnot. But essentially it sets up that structure that we have those 3 or 4 meetings in the year, and ideally we like to bring everyone to the table for that, the nutritionist, the herdsman, and the bank if they're willing, who ultimately make a lot of the decisions at that table, and rightly so. So essentially, the call to increase food production with minimal environmental impact is there. And there's a risk that other issues may be seen to have higher priority than animal health and welfare. But remember that that link between health and welfare is intrinsic with productivity. So my advice to you would be build your farm team, embrace those new technologies, some of which may be in other sectors. Have courage to change the things that you can, and prepare for change, because change will come and is guaranteed. So as I said before, do try to strive to set yourself a target. Do set yourself your goals. This is from a farm that I was on in America. And essentially he'd set out his goals, and this was the farm gate. As you drove through, this is what you saw. Quality milk, comfortable cows, environmentally friendly practices. I would encourage you all, work with your vet and set those priorities. Set those goals as realistic goals, and good luck in doing it. Thank you very much.